Hi, this is Dana Kern recording my Skills Blog 3. There were many skills I would use to secure staff that I identify on the leadership questionnaire in Chapter 7. The result of the leadership questionnaire was that my strength was interpersonal skills, knowing ahead of time how I think people will perceive my ideas, understanding the social fabric of my organization, sensing the emotional undercurrents of my group, respecting my opponent during conflict resolution, and finding consensus in conflict resolution are all leadership skills that I scored high in. I believe I scored high in these leadership skills because I value relationships and feel that organizations excel when there are strong relationships between peers and nurse managers. I also think a strength of mine is motivating. Finding what my peers' needs are and ways to help satisfy their needs will help motivate them at work. If a manager puts effort into keeping their staff happy, their staff will hopefully in return the favor and work hard to make their manager happy. I would use the published literature to learn how to motivate my team into being great caregivers and team players. What I like about team nursing is the emphasis placed on all participants in the patient care plan. I would need to work with 3 different levels or departments to be an effective manager. The first level would be upper management, the people managing the unit managers. The second level would be the staff nurses. And the third levels would be the doctors who see our patients. I would need to work with upper management in order to see if what the hospital goals were. I would work with staff to ensure patient-employee satisfaction and to make sure goals were being met. I would need to work closely with the doctors in order to keep open communication between the physicians and nurses. I would prefer the horizontal differentiation. In a hospital setting, there needs to be separation of activities in order to have efficient and effective work performance. As mentioned before, I would use the team nursing model. This concept uses all levels of personnel to their fullest capacity in giving the best possible nursing care to patients. I would not use the team nursing model in the traditional way, but I would use the concept of a committed team working together towards a shared goal. I chose a peer-reviewed scholarly article called Implementation of a Nursing Professional Practice Model of Care in a Pediatric Hospital. I chose this article because I work in a pediatric hospital. The model of patient care was called the Synergy Model. The concept was a framework that outlined nursing practice to help nurses develop competencies that they would need to care for patients and families. When nurse competency matches patient characteristic and needs, it improves outcome results for the patient, family, and healthcare system. They called the practice model synergy because individuals work together in mutually enhancing ways and get synergy results. It looks at nursing as meeting the needs of patients and families, not just completing a task. The synergy concept is important for a pediatric hospital because it incorporates the nurse, patient, and family as equal participants in the care plan.